Today I want to talk about incision design in facelifts. So this particular patient's about a little over a month out from her face and neck lift, and we did a little bit of a brow lift and upper blepharoplasty as well. But today I want to focus on the lower face and the neck and incision design. In a face and a neck lift, one of our primary objectives is to restore the youthfulness of the face, the prominence of the cheeks, reduce the nasolabial fold prominence and the jowling, and recontour the jawline and the neckline. That is very much a primary objective in a facelift, but we also have to get in there, make incisions, and do all that work while making it look like we were never there. A very well thought out and calculated incision is one that should be imperceptible when it's all healed. The classic incision design for a facelift in which skin needs to be redraped and removed is to place some portion of that incision in this temporal hair. I prefer to make that incision just subtly behind the temporal hair because when we're finished with the facelift, it does not move the sideburn back. In the old days when facelift incisions were placed back here in the hair, it would pull the sideburn back, and it was a dead giveaway that someone looks odd or a facelift has been performed. When it comes to the tragus, a lot of times we place the incision behind the tragus here in order to hide it. But when a patient has some wrinkles in front of the tragus of the ear, I can place that incision in a pretragal fashion, and it just looks like a normal natural wrinkle in front of the ear. And if you look very closely in this patient, you can see that subtle pink color of the incision healing in front of the tragus. But when that's all healed, it's going to look like a normal contour change between cheek skin and the tragus. Every facelift incision by me is something that's very well thought out. It's really not a cookie cutter approach in every patient. I look at the hair pattern, I look at the tragus, and I really think about what is the best way to conceal these incisions for access into the face.